We are back on Morning Line on this Wednesday. Clint Kelly, Nick Barris just got off the phone with, I think it was Charles who called in a moment ago and talked about how it seems like he may have suffered some severe burns by something that happened while he was in some type of physical therapy and his legs have to be scraped. Now, on this case, you're going to have to find out more details, whether or not this was what was prescribed to him or if it was just some crazy mistake. You talked about this other case that came through this program that actually is something that's being litigated, or maybe, where there was an individual went in, they sprayed something wrong on his wound.
Yeah, I mean, and that's a complete negligence case. I mean, even the hospital knows it is because they wrote it in the note that it was a mistake, but they sprayed ammonia, surface disinfectant, into a man's open wound before applying sutures. Of course, it burns like fire when it goes in there.
They were thinking it was an antiseptic. It had been accidentally left out in the same rack with the other stuff, and they grabbed the wrong bottle.
Correct. The janitors had left it out next to the examination table. Yeah. They just grabbed it and started spraying it. And you were asking, how does something like that happen?
I mean, how does that happen? Where's the protocol?
And all those reasons you described, the high volume, the lack of attention. By the way, emergency room physicians or physician assistants are now being staffed in hospitals, and they don't even live in the community where the hospital is. Some of them fly in from Knoxville.
Why? Why is that?
It's because the physician groups that are hired by the hospitals that they are able
that's crazy. So they bring in, ship in their staffers?
Exactly. They're shipping in these people.
Now, by doing that, what does that mean? I mean, how is that? Is that a bad thing?
I think it is, because I think there's a lack of continuity in care. I think there's a lack of protocol being followed because you're having so many different people brought in and brought out. And, you know, Nick, think about this. Who wants a doctor taking care of them who has no relationship with the community?
I guess.
It may be a small thing, but it's a big thing to me.
Okay, really? Because, yeah. I mean, I guess I see what you say. I mean, local, but I don't mean that someone from out of town is going to be an any worse doctor, you know, and they have the Hippocratic Oath, and I think a doctor, regardless of the patient, where they're from, is going to do their best, right?
Well, I think a doctor who's in the community understands the patients better and understands the routines better, as opposed to someone who just kind of ships in and ships out. We were talking last time about internal medicine doctors who are now hospitalists, who work in the hospitals. A lot of them ship in and ship out, and so you may wake up one day in the hospital and have one doctor taking care of you, and then the next day got a completely different doctor taking care of you, and the two may not even talk.
Not on the same page, and that's where you've got cases maybe where one medicine's prescribed after another one's there.
Yes.
You get a toxic combination.
Yes.
When's the last time you spent any quality time, not maybe as a patient, but for any reason, in an emergency room?
Oh gosh, years ago. I can't even remember last time.
I've been in some where, surprisingly, wasn't that busy that day, but especially some areas when I've been over at Vanderbilt, which is a big hospital. It's very busy, and I can imagine the emergency rooms in some of the big cities. I have a nephew who's an emergency room physician in Chicago, and I'm not trying to make excuses for them. I guess you have to staff them, but I mean, that place is chaotic and crazy, and it surprises me not the least that mistakes and mishaps happen there. Not that they should, I don't know what the solution is, but some of these emergency rooms, I'm wondering how it doesn't, really bad things don't happen virtually every day.
Well, there is such a thing, Nick, as being set up to fail. If you set up a system that's so overburdened and understaffed in order to maximize profits, there's going to be a failure rate that's going to be associated with that, regardless of who you put in there.
So, I mean, they can ultimately correct it, and most of the time when services aren't provided to the level they should be, and I don't care what we're talking about, hospitals, prisons, schools, it comes down to one, you can make the argument that, well, is there some waste, we're not doing it right, and how well run it is, and that's certainly worthwhile, but it ultimately comes down to money, and whether or not they're putting the money in to do it right, or they're trying to cut the corners to get the maximum dividend for their stockholders.
There's one other thing I want to mention, Nick, that I'm starting to notice as well, and this may be, again, because of the volume of procedures that are being performed by surgeons, but I'm seeing more and more burns associated with either surgical treatment or primary care or emergency care. And it's either a burn through an instrument, a burn through a particular type of prescription medicine, or a certain type of treatment. And I can't explain it, but I'm hearing about people going to the burn unit from time to time as a result of these burns. And it seems to me that doctors or other healthcare providers are not taking enough time to ensure that the treatment they're providing or the surgery, that the risk of a burn is minimized. I can't explain why it's happening, but I mean, Charles is yet another one of someone who's been burned in the course of some type of therapy, and it's becoming much more frequent. I wish I knew the reason why.
Hey, I'm curious, have malpractice attorneys, I don't know you or others, taken on cases for prison inmates ever where they've gotten clearly, and it's happened, we've seen it just as it does in normal hospitals, substandard care, and it's really messed them up?
Yeah, I have not taken a prison case before.
But that happens too, doesn't it?
It
I mean,
does happen.
I've seen cases clearly where something went wrong, and the fact that they're inmates doesn't mean they shouldn't get.
No, they deserve
Well,
basic
there's
care
words
as
of
well.
the state. They have to, they may not get the very best, but they get the base of what should be required for a treatment of something.
Correct.
And I mean, I've seen a few cases of late along those lines. What about, we talked last time you were on just a little bit about, can you sue if you end up with one of those nasty infections after the ones now, you go into a hospital now, what MRSA or some of these other staph infections that seem to just be rampant in hospitals, no matter how much they try to keep it clean?
The questions you can sue, and you may have a case, it really depends on, did the staff fail to monitor the infection such that the infection got worse over time and ultimately killed the patient or caused a devastating injury. I've got a case right now with a guy who's lost his foot, had to have it amputated because an infection got out of control because the doctor slow walked it. That's really where it is. It's hard to prove that the genesis of the infection is negligent because, as you say, there are so many bugs now in hospitals, it's almost it's an acceptable risk to take. But it's the failure to diagnose the infection and treat it that gives rise to these cases.
Are there some hospitals in your mind clearly that are just cleaner than others?
Yes.
I guess what do you mean? What do you mean?
There are better hospitals, Nick. There are hospitals that are safer. There are hospitals that are cleaner. There are hospitals that follow protocol better versus other hospitals, even here in Middle Tennessee.
And in your mind, is there a way, I'm not going to ask you to name hospitals, but is there a way someone can research that to determine which hospitals may be like that?
Yeah.
How would you do that?
Ask a malpractice lawyer.
Okay. They'll know.
Yeah.
I mean, obviously, you probably see more cases sometimes coming out of
that's true.
certain hospitals, just as you would if you're checking on a doctor that's got issues.
I mean, I get two types of calls outside of my office that don't have anything to do with my business. The first call is maybe from a friend saying, do I have a case? What should I do about this? The second is, what do you think about Dr. X?
Mm-hmm. Okay.
Is he good? Is he someone that I should go to? And if not, who would you refer? Who would you think that I should
So
be
you may
referred to?
know some of them?
Correct. And I can tell them, I know generally who bad ones are.
Yeah, because they pop up time and again.
Correct.
Along those lines.
I think 10% of the doctors commit 90% of the medical malpractice.
Yeah, which is, it's nice to hear you say that. Let's remind ourselves as we talk about this and you come on, you have all these cases, 90% of the doctors out there are doing the best they can and do a good job.
Right.
90%. But then that 10% can cost who knows how many lives
And
or injuries.
many of those 10% are repeat offenders.
And repeat offenders. Real quick, as we wrap things up, the main thing again, we'll give the contact information. If you want to throw that up there with Clint, we'll do it again in the last segment. But where you can reach Clint Kelly, your office is there in Hendersonville.
Correct.
All right. And the important thing as we look at the number on the screen is if you think, just like from Charles who called earlier, and his incident with the burn was back in April, that's within the window.
Correct.
Call him before a year passes. There's something called the statute of limitations.
That's right. And the call is free, Nick.
Yeah.
Call is free. You lose nothing by making a call and having a consultation.
Talk to Pat at your office.
Correct.
But the bottom line on this, he's had people, people that came in with cases he would have loved to have taken. He hears it all and he's like, wow, we got a case, let's get it going and get some relief for you. And then he says, by the way, when did this happen? And it was over a year. I mean, you must want to bang your head against the wall. And the poor people who were definitely done wrong and they didn't know any better come in late. Don't put it off. It's just like call today, get into this, and find out whether or not you have a case. You may not. Clint,
Nick,
as always,
thank you so much.
It's a pleasure having you on. We'll see you again soon, my friend.
Thank you.
All right, we'll take a break. I'll be back with that information again on the screen and a programming note about tomorrow right after this.